Joining me now from Jerusalem is Irris Makler. Irris, despite the lockdown and the vaccination drive, just how is Israel actually faring?
It's not faring well. The news is bad and the numbers are worse than the scientists predicted. The illness, the R number that measures contagion has crept back up to 1. New cases are where they were before the lockdown began. Hospitals are full as they were before the lockdown began. And the death rate is climbing too. I think a quarter of all the people who've died in this past month. So all of that, despite this vaccination campaign, and health officials and the medical experts that I've interviewed myself, they all point to the UK variant. It's come into Israeli society. Let's say we knew about it a month ago. Let's say it was here 2 months ago. It's now between 70 and 90% of all new cases here. That's a huge number. And the impact is it's much more contagious. It may also be more deadly. So all of that taken together means that although there is good news in that the target group, people over 60, have now received, most of them, the majority have received 2 vaccines, their numbers are declining, but the overall numbers are going up because of the UK variant.
So what's the next phase of the country's vaccination strategy?
Here's another interesting paradox. Israel is extremely fortunate. It has all the vaccines it needs. It's built special storage facilities for them so they can be kept at sub-zero temperatures. It's got centres that can do 200,000 to 250,000 people a day. Only about 100,000 are coming. So what that means is the people who really wanted to be vaccinated in those age groups have been vaccinated. Israel has now opened. Anybody over 18 can get a vaccination here. 18 to 80, come on in. It wants to pick all that low-hanging fruit. And then they have to target the communities that are more reluctant. That traditionally includes the ultra-Orthodox, Arab communities, Palestinians living inside Israel, in East Jerusalem, and also in the West Bank, by the way. There's great vaccine hesitancy there. And then there's the group of people who just don't want to be the first and are worried about side effects. So Israel's got a campaign beginning to target them. And given what we know about the UK variant targeting younger people, perhaps this action now of opening the vaccinations to all ages actually may turn out to be very good.
Irris Makler, thank you for that. And time now for a